Today, we're diving into something really fascinating, a set of psychological tools designed to act like a window into the mind. We're talking about projective techniques.
So, let's kick things off with a huge question, one that has puzzled psychologists for ages. How do you actually get a look at the stuff going on deep inside someone's mind? You know, the thoughts, the feelings, the conflicts that we might not even be aware of ourselves, or maybe the parts we're trying to keep hidden? Okay, think about this for a second. We've all done it, right? You're looking up at the clouds and you see a dragon, or a face, or a dog. Of course. Well, that simple act of seeing a shape in a random pattern, that's actually the key to understanding this whole idea of projection. It's the perfect starting point. All right, so let's get into the core idea here. What does projection really mean when we're talking about psychology? And more importantly, how do we use it as a tool? This is the bedrock of it all. It's called the projective hypothesis. And the idea is pretty simple, really. When you're shown something vague with no clear meaning, your brain can't help but try to make sense of it. And to do that, you have to project your own stuff onto it. Your own feelings, your needs, your conflicts. You're basically filling in the blanks with parts of yourself. So what makes these tests so different from, say, a multiple choice quiz? Well, for one, the things you're shown, the stimuli, are meant to be ambiguous. The whole process is also indirect. You don't really know what the psychologist is looking for, which makes it harder to censor yourself. It's not about yes or no answers. You have complete freedom to respond. And here's the kicker. There are no right or wrong answers. It's all about your unique take on it. Okay, so that's the theory. But how does this actually work in a clinical setting? Well, psychologists have come up with a bunch of different methods based on this idea. We're going to walk through the 5 main types. A really helpful way to organize these is using what's called Lindsay's classification. It breaks them down into 5 groups: association, construction, completion, choice or ordering, and expressive techniques. Let's take a look at each one. First up, we've got association techniques. And you've probably heard of this one. It's the most famous category by far. The idea is super simple. Someone shows you something, and you just say the very first thing that pops into your head. No filter. It's all about getting that immediate gut reaction. And of course, the classic example here is the Rorschach ink blot test. We've all seen it in movies, right? Someone is shown these weird, symmetrical ink blots and asked a really simple question. What might this be? The answers they give are then analyzed to get a sense of their personality and how they're doing emotionally. All right, next we have construction techniques. These take things up a notch. The task is a little more involved. Instead of just giving a quick association, you're asked to build something bigger. Usually, you have to create a whole story. Take this image, for example. This is from the Thematic Apperception Test, or TAT. A clinician would ask you to make up a story about this picture. Who are they? What's going on? What led up to this moment, and what's going to happen next? And the themes that show up in your story, maybe it's about ambition, or conflict, or failure, are believed to give clues about your own inner drives and motivations. Our third category is completion techniques. And yeah, it's pretty much what it sounds like. You get an incomplete sentence, like a sentence stem, and you just have to finish it. The goal is to complete it with whatever feels right to you. So you might see something like, I am always, and how would you finish that? I am always tired. I am always trying my best. I am always late. See? The way you fill in that blank can reveal a lot about your attitudes and feelings, often without you even realizing it. Okay, number 4, choice or ordering techniques. Now, this one is a little different. It's less about what you say and more about how you organize things. You're given a bunch of stuff and you have to put it in an order that makes sense to you. A really neat example is when someone gives you a bunch of comic strip panels all mixed up. Your job is to put them in the right order to tell a logical story. The way you decide to sequence those events can tell a psychologist a lot about your thinking and how you understand social situations. And last but not least, number 5 is expressive techniques. This is where we move beyond just words. Here, you're actually asked to create something. Maybe you draw a picture, or paint, or even act something out. The thing you make is seen as a direct expression of your inner world. A famous example of this is the Draw a Person test. It's super simple. The instructions are just draw a person. But the details in that drawing, the size of the head, whether the hands are hidden, what's emphasized and what's missing, all those little things are interpreted as clues about how you see yourself and the world. Okay, so we've gone through all these different types, but the big question is, why? Why do clinicians use these? What's the point of them in the real world? Well, they're considered really valuable for a few big reasons. First, they can open up a door to our unconscious thoughts and feelings, the stuff we can't easily put into words.
Second, because they're so indirect, they help get around our natural defenses, that little voice that censors what we say. And finally, they're super helpful in situations where someone might struggle to talk about their feelings, like with young kids, for example.
But, and this is really important, we have to keep these tests in perspective. They are not a final verdict on who you are. Think of them as offering one particular viewpoint, not the whole picture. So if you compare them to objective tests, like a standard questionnaire, the difference is huge. Objective tests are structured with fixed choices like true or false. Projective tests, they use ambiguous stuff. They're all about free, open-ended answers. The whole point is to be indirect, to discover things, not just to measure them.
And that really brings us full circle, back to that idea of a window. These techniques aren't about sticking a label on someone. The goal is simply to understand. They provide one possible view, a glimpse through a window into the incredibly complex inner life of a person.
So let me leave you with a final thought to chew on. Now that you know all about the power of projection, it makes you wonder, doesn't it? If you could look into your own imagination, what parts of yourself, maybe even parts you didn't know were there, might you see looking back at you?